Good evening. Hello, everybody. I'm Nancy Worley, Interim General Manager at KPBS, and I want to welcome all of you to tonight's conversation, Unsheltered, Solving Homelessness in San Diego. That title holds a pretty big promise, and we know we really won't solve homelessness in an hour, but what we will do is start this important conversation. Now, there is a perception that more people are unsheltered in San Diego, and there are statistics that point to that conclusion. But as a region, we won't have the latest numbers until the results of the annual homelessness count are released in the weeks ahead. Now, what people do see are encampments that have cropped up in parks, along sidewalks, and public property. What homeless experts know is that deaths, especially drug deaths, among the unhoused in the nation are rising, and that those on the streets are increasingly frail and elderly. San Diego officials are looking for solutions, both short and long term, but it's a complex issue. Now, tonight's panel will discuss strategies for reducing the number of people living on the street. Is housing first the best approach, or addiction treatment? And how do you find housing for so many when housing prices are skyrocketing? We asked many of you for your thoughts and questions about the topic beforehand. And one of you wrote that homelessness was not just a problem of housing or addiction, but of community. You are here as a community member who care about this issue. I invite you to ask your questions in the chat, and we will try our best to get to all of them. Now, I'd like to introduce to you our moderator, KPBS Metro reporter, Andrew Bowen. He covers a wide range of issues, including local government, transportation, and housing. Andrew, thanks for moderating this topic tonight.
Thank you, Nancy. And welcome to everyone. Thank you for joining us for this special KPBS event. As Nancy said, I'm KPBS Metro reporter Andrew Bowen. I have been covering local government in San Diego for close to 6.5 years now. And there has never been a time in all of that time when homelessness is not ranked number one or maybe number two among the priorities of our elected leaders. And if it has been number two, then number one was housing affordability. And of course, we know that these are two sides of the same coin. One of the hardest days of my career was March 15th, 2021. That's when a man drove his car onto the sidewalk of B Street at San Diego City College and killed 3 unsheltered people who were sheltering from the rain underneath a bridge. Their names, by the way, were Rodney Diffendahl, Randy Ferris, and Walter Jones. Many people in San Diego see homelessness as a nuisance or a quality of life issue. But as Nancy alluded to, the growing number of deaths that we see on our streets, from car crashes and traffic violence to overdoses to hepatitis A and other preventable diseases, they make it clear that this is not a nuisance, it is a humanitarian crisis. So how do we solve this problem? We've got a panel of very great experts eager to dig into that question and limited time, so I'm going to introduce them now. Our guests tonight are Lisa Jones, Executive Vice President of the San Diego Housing Commission, which oversees homeless services and affordable housing on behalf of the City of San Diego. Also joining us, Bob McElroy. He is founder and CEO of Alpha Project, a nonprofit service provider that operates both temporary shelters and permanent supportive housing and affordable housing. Tamara Kohler is CEO of the Regional Task Force on the Homeless, a county-wide agency that distributes state and federal resources and also collects data on homelessness, among many other things. And we're also joined by Jesse Gray, who is a veteran who experienced homelessness himself and has since become an advocate for the unsheltered. So welcome to all of our panelists. And we're going to start by watching a very short video. For folks who are not able to see this, I'll be describing what's happening as we watch. And for just a bit of context, this video was taken in the East Village near Petco Park on the morning of April 14th, which some of you probably will know was the opening day for the Padres. The city, prior to this video being filmed, had posted papers around some of the homeless encampments, saying that in 3 hours, this area will be cleared and abandoned property will be thrown away. crushing the bicycles that belonged to people who were living there. So as this video started to go viral, the city issued a response on Twitter saying that the bikes were deemed inoperable because of broken or missing parts. But I can say, looking at the video, the bikes were operable enough to be wheeled by those people who were throwing them in the dump truck, and they didn't seem to be broken beyond repair. I'd like to start with you, Jesse. What goes through your mind when you see this video?
It's kind of what I see there is maybe there was one or two bicycles outside of that frame that were inoperable, and they kind of use that as blanket justification for depriving these people of things they may have needed to continue out there. So it's a little frustrating to see that.
When you experienced homelessness, did you ever rely on a bicycle for transportation, and how much was mobility a challenge to you accessing the services that you needed?
The majority of my homelessness was in San Francisco, and I did a lot of walking. I was fortunate that I could get to what I needed to in a small radius.
Tamara, we know that San Diego has increasingly relied on police and the enforcement of encroachment laws and abandoned property laws to manage homelessness. They say, of course, they're responding to illegal activity or maybe complaints about encampments. But we also know that enforcement of crimes related to homelessness can trap people in this death spiral of increasing fines. And enforcement also isn't cheap. Officers are often earning overtime while they're doing this work. So what role, if any, should police play in our response to homelessness?
Well, thank you, Andrew. I think, our police are there to protect the citizens. And I think enforcement's a part of their jobs. We really have a strong process and practice around addressing our unsheltered population that really should lead with our outreach teams and strong engagement, really having our officers respond when there is a call of need or a crime that is happening is the best use of law enforcement in a community. We've worked really hard to have outreach at the front lines of this work. And there's actually some strong practices and policies around engagement, around when an encampment may need to be moved for hygiene or cleaning or even abatement to protect personal property. So I think, we have some strong practices in this community that we should adhere to and follow that are understood by individuals experiencing homelessness as well.
Bob, you also experienced homelessness at a time in your life. I'm wondering if you have any thoughts as you watch that video.
Well, I was bummed out because I recognized some of those bikes. We hand out bikes all the time. We have donors that come down to the shelters, and that's one of the only modes of transportation that a lot of our folks have. They go back and forth to work on those things. On the other hand, there's other folks that have stolen property. So, enforcement is a dicey issue. I'm pro enforcement in certain instances. Certain cases. We're doing 50 Narcan interventions every 2 weeks. We jump in. My outreach chiefs jump out, and somebody's blue in a tent. We pull them out and shove Narcan up and bring them back to life. I see little kids walking to Perkins and Monarch School, walking in the street because the sidewalks are blocked by tents. So it's a damned if you do and damned if you don't situation. I think we need to really, groups like this. I mean, the pros here are on this. What are we doing here? Seminar. What are we doing here? Yeah, whatever it is. Get together for all of us, sit down and really strategize on the best ways to address the issue. The reality is there's got to be a place for everybody to go. You can't enforce encroachment and other things unless there's an opportunity for somebody to have an alternative to being homeless. And until we get to that point, it's going to continue to be the way it is.
Shelters like the ones that you operate provide people a place to not just to sleep, but also to store their belongings. And the city also has a storage facility to keep their stuff. Are these resources simply inadequate? Is that why we're seeing so much of this property sometimes abandoned on the streets or sidewalks? Or are there other barriers to accessing them?
Well, are you asking me?
Yes, Bob, that was for you.
I've never seen, in my 35 years, I'm waiting for these numbers to come out from the point in time count, but I've never seen a concentration of folks in my 35 years that I see today. I mean, there's folks everywhere. So it's telling me that we certainly need more. The first step of recovery are the shelters. And then through those shelters, we distill those people into, the housing and jobs and other forms of treatment and service. But, I drive the streets every day and I talk to people every day, and for the first time in my 35 years, I don't want to be snarky or anything, but I'm throwing my hands up. I don't know what to do. We just don't have a place for everybody. And then we have to have people that are also willing to take the services that we offer, and that's the biggest challenge right now. You'll see these outreach teams that go out and make 200 or 300 contacts, and 15 people take them up on the offer for help. So I think all of the stakeholders in this need to sit around a table and instead of just talking and having endless meetings, actually come up with a comprehensive plan. And we are working with some of the Housing Commission for sure. And how do we make a big dent in this now and not 5 years from now?
Lisa, I'm going to turn to you. I think Tamara alluded to, the city cannot issue a citation for somebody who is maybe blocking a sidewalk or hasn't complied with an order to move their property, only if there is a shelter bed available for them. On average, what is the average vacancy rate of a homeless shelter on a given night? And why might a person refuse or decline, access to that shelter?
So it can vary based on the number of intakes that are done on a given day. The Housing Commission runs coordinated intake for every city-funded shelter across the system, and actually a few shelters that participate that the city doesn't fund. As an example, there were 71 beds available for single adults this morning. As of this morning, we actually collect that data on a daily basis so that we also collect data on what type of shelter bed is available, because people have different needs, Andrew. So that sometimes is the challenge. We may have shelter beds available, but we don't have a shelter bed available that meets someone's specific needs, which is why continued investment that you're seeing with the new women's shelter that came online recently, with the new shelter that is coming online in the coming months, is trying to create, I would call it a continuum of interventions, because for the first thing, people have different needs. They also have different preferences, right? So we need to understand that choice in those options is really critical. Someone who may not engage in this type of environment might engage in another, and really looking at building out a continuum of interventions to meet unique needs is going to help people make that choice.
San Diego Mayor Todd Gloria just released his proposed budget. Lisa, can you give us an overview of what you're aware of some of the homeless funding that's in that budget?
So there's deep investment continued in crisis response, harm reduction, the partnership between the city and the county over the past couple of years with the political will that we've seen has really been something. It's allowed us as sort of practitioners of the work, working with county behavioral health, to start looking at different models to better meet people's needs. The harm reduction shelter that you saw come up last December, which is continuing funding, obviously, into this next fiscal year. The new structure that Chair of the County Board of Supervisors, Nathan Flencher, mentioned at his State of the County address. I can't speak too much to that, but we're looking up to another 150 beds there. The women's shelter, which is a great new project because it meets folks' needs with folks with higher needs, right? With mobility issues, higher mental health or behavioral health issues. So really trying to plug the gaps in some of the existing system. So those crisis intervention, harm reduction, safe haven is another project we're working on with the county through city and county funding, really to do a better job of meeting some of those greatest challenges. Speaking to what we've heard some folks share about the concerns around fentanyl and substance abuse, how do we develop programs that better meet those people's needs?
Jesse, can you share some experiences or memories of time that you might have spent in a homeless shelter or sleeping on the street? What was that experience like, and how did it affect you?
The majority of my experience was spent sleeping in my car and at hotels when I could still afford it. When funds got really tight, I just had the money for the gas in the vehicle, and then I was showering at different gyms around the city. I never went to a shelter, and it's kind of for the reason why that Lisa had mentioned. It just, that situation was not going to help me get back on my feet like I wanted to. The density was a mess, and the staffing, they looked like they were stressed and not knowledgeable. So that wasn't something I wanted to turn to. So it was mostly in my vehicle, and it was a traumatic time, but being a veteran, I was leaning on some of that resourcefulness at the time. And then also, Lisa, you were speaking about bridging the gaps. What I found even here when I was looking for houses is finding that information. There's tons of resources in the city, and I'm really thankful for that here, especially compared to San Francisco. But finding where they were was a maze. And so having it is one thing, but getting that information out is another.
Jesse, do you think what kind of shelter would have been a place that you could have seen yourself actually turning to or feeling safe and comfortable going to, on those nights when maybe you didn't feel like you could sleep in your car, or you for whatever reason you couldn't do that? What type of shelter would have met your needs? How would it have had to have been different than the ones that were available at that time?
The quality of living was just not there. I was in and out of jail briefly back in 2018. And to me, the shelters looked no different. The quality was dehumanizing. So just something that makes the people feel like they're still human.
Bob, can you kind of give us a look inside some of the emergency shelters that you operate? What do they look like? How many people are there? Who are the people who are staying there? What kind of services do you offer?
And I hate, just like the word homelessness, and all the negative visuals that brings to mind: bag lady, dump diver, panhandler. We dehumanize people with labels, and the shelters have been the same way. We don't call our shelters, we call them communities. In fact, we've had many, many people, and Lisa can attest to this, that have been matched to housing. They can actually move out. We have a place for them to go, that don't want to go because all their friends are at the shelter. We try and make it as accommodating as possible. Yeah, it's tough. We are 28 inches, away from each other. And it's amazing to me. It's really a testament to the folks that we have living in our facilities, that they can live in a communal setting like that. But we make it as comfortable as possible, as accommodating and humane as possible. When we tell people when they come through the gate, you're no longer homeless, your mom, dad, brother, sister, grandma, grandpa. And really, we're run by the folks that live there. They have a vested interest in making our facilities as accommodating and as safe and pleasant as possible. So I invite people to come down and actually see what we do. I can't speak to other facilities, but we have 20 folks a day that go out in the community on wheels of change and clean up. It started in East Village, but they go for 4 hours, and they have a 2-hour commitment, being a social worker and mentoring their brothers and sisters that they've camped with for 20 plus years. They brought many people who were shelter resistant into the facilities, and we're trying to change the negative perception of what homeless folks are. They're just like everybody else. And so our philosophy is bringing the humanity back to folks. There's no humanity living on the street, believe me. People are pushed from one corner to the other, and we know all the issues that are out there. And I'm not speaking to the 15% or more of the population that are severely mentally ill, that can't access any facility simply because of their mental health challenges. I mean, that's just despicable. I felt like John the Baptist, the one crying in the wilderness for 35 years to do something for these folks, because they're there for no choice of their own. And I'm hearing now, maybe from the state, that we are going to start addressing that issue. But for the rest of the folks, it's really a starting point for people. People work at the facility. People go out to work. They go to City College. Many people work in the hotels. We did a job fair. We had 30 people hired by the downtown hotels, those who are able to work. And we try to make it as a community and not a shelter. So I invite people to come down and do a walk around. I think it'll change your perception of what shelters are. Our shelter.
Lisa, I'm thinking back to 2017 when the hepatitis A outbreak tore through the homeless community in San Diego. And that was when the then Mayor Kevin Faulconer created the bridge shelters, which the Housing Commission oversees. And they were meant to be a temporary place for people to stay while they waited for permanent housing. What I was thinking at the time is that this was being announced is, we don't have hundreds or thousands of vacant affordable housing units that all of our unsheltered population is, all they need is to be connected with the services. They actually don't have that housing because it doesn't exist. So
Amen.
what's the share of people who exit those shelters, the bridge shelters, for permanent housing nowadays? And what have you learned over the several years that those have been in operation?
I remember that time well. I actually started working for the Housing Commission in late October 2017. And I remember in spring of 2018, I was trying to, if you go back and look at city council recordings, trying to explain that the premise of it, assuming everybody's going to exit to permanent housing was a little lacking, right? And we needed to really think about what that means. And we have really gone towards a housing focused case management that looks at any opportunity to exit to longer term or more permanent housing, because not everybody is going to exit with a housing subsidy. We do not have those types of resources in our community, even with the additional resources that have come because of the impact of the pandemic. We can't, as many people say, necessarily build our way out of this. And a lot of folks can action other options. Some folks actually need independent living care. Some folks can reunify with families. Some folks can end up in shared housing when they're going through job fairs and they have the ability to work, right? You want to align the housing resource with that person's individual needs. And not everyone needs the same things, and we don't have enough resources to go around. So what we don't want to do is create an environment and an approach that we're just waiting for housing to happen. We have to have conversations between case managers, between people who are ready to move forward about what the variety of those interventions, those opportunities can be. So to talk about sort of positive exits, we look at positive exits when we see someone exiting to transitional housing, someone exiting to adult independent living care, nursing home, shared housing, family reunification, permanent supportive housing, which is that deep subsidy and ongoing case management and wraparound services, rapid rehousing, which is anywhere between 6 to 24 months of housing subsidy and services. I think that that's critically important to align the resource with that person's need and not set an expectation that everybody's going to exit with a permanent supportive housing voucher, because they're not, right? So on average, anywhere between 25 to 30% exits to permanent supportive housing and long-term housing. Then, of course, we have a small percentage in our shelters where people sort of turn over again and again. People come in 7 or 8 times in a 4-month period. They're really coming in, stabilizing, getting some basic needs met, and exiting back out again. And oftentimes that is really paired with co-occurring conditions, whether it's substance use disorder, behavioral health issues. So having additional resources coming into our system and into our shelters that have those behavioral health assessments, those substance use resources connected to them, like the harm reduction shelter, is really important to figure out a way to better engage with those folks and those in that moment when they're in shelter, to try to create an environment that feels stabilized, that feels like there's opportunities, so that we slow down that turnover and provide stabilization opportunities for folks.
Jesse, you are a lived experience advocate. Can you explain what that means and how, take us on that journey of how you were able to exit homelessness and take on this role of being an advocate for folks who are in a similar situation as you were once?
So going back to what I was saying about how I was applying for housing here in San Diego and exploring all the different resources, I also was reaching out to the different churches in the city and making notes of the issues I was running into when I was reaching out to different numbers. And there's an advocate that's a member of Uplift, Monica Ball, and she said that there was a group of people that addresses issues like that. And she referred me to John Brady, the director of Lived Experience Advisors. And what they are, as everybody on this line knows, is a group of people that have experienced homelessness and also provide input into the system at different processes. For instance, on Monday, we were at City Hall when the budget was being gone over. So I see that it's a catalyst for change, and I want to help make a change and help people kind of avoid the issues and the hangups that I ran into, and there were many.
Can you give us a few? I mean, what are some of the biggest challenges that you faced?
And here in San Diego, so when I got here, I was living out of a hotel and looking for housing, but because of my accounts going to collections from San Francisco 2018, I wasn't going to get approved for housing without assistance. So the fact that I was a veteran helped in that process, but without a voucher or something of the equivalent, landlords weren't going to really work with me. And there was a gap with that. The communication between the people that have the houses and the programs that will provide support, there's a disconnect there. So, and then some of the shelters like VBSD in San Diego, the quality was not going to be conducive to help me continue moving forward. What else? Wait lists. Some of the wait lists that I heard were out to half a decade. So I was on a tight timeline to avoid being back out on the street. There's a 28-day legal limit in the hotel, and I still remember what it was like in San Francisco, and I know that I didn't want to repeat those issues. The stability was what I was looking for, and that led me to Lived Experience Advisors. Since then, I've joined RUN, Residents United Network, and they just had a bill passed through housing this morning that would kind of consolidate a place for people to apply for assistance and not have to drive all over the city or try and coordinate with all these different schedules. So,
Tamara, we know that permanent supportive housing is really the gold standard for ending chronic homelessness, especially for people with underlying issues like disabilities, addiction, mental illness. How many permanent supportive housing units would we need to get everyone out of homelessness and onto the streets? Assuming, money is no object, do we know how many of those units we need and how much that would cost?
Andrew, that's a really good question. We did some modeling for the city that's in the city plan, but I just want to level set that permanent supportive housing isn't for everyone experiencing homelessness. It's really for those chronic high needs that need the level of support. I think Jesse's experience is really a clear picture of it. Not everyone experiencing homelessness looks like we think they do or having the challenges that we expect. It is a really complex and diverse population. So the permanent supportive housing is a little bit higher need and needs that level of support from behavioral health, tenant supports, and many of those need a level of housing vouchers as well. And I think, Lisa, what did we say about 10,000 units or that were needed long term? And I think that's
right, not
challenge.
just permanent supportive housing. So it looked at affordable housing, permanent supportive housing, rapid rehousing, prevention, diversion, and it ended up being $1.9 billion dollar investment over 10 years. This modeling was done though in 2019, right? A lot has changed since then. Our rental market itself has really seen big increases just over the last several months. And we know that as we get data from the point in time count that Tamara was just, is coming out, RTFH leads, and some of the other homeless inventory count data, that we will probably be doing a recalibration of those community action plan goals and numbers.
So this problem is presumably getting more expensive and not less expensive.
I think housing is getting more expensive for all of us, right? And it is not getting better generally. And in that space, Andrew, our prevention work and catching people early and helping them retain housing is as much a part of the solution as it is for our permanent supportive housing. Our system has to look at everybody and try and house at all levels. And I think that was part of what Lisa is sharing is permanent supportive housing is not the gold standard. It's the standard for people who need that level of care. But if we will work with people, Bob, talked about people who have some income that have an ability to be able to get units, we really just need housing stock in a level and a capacity that is needed for this population. And we need landlords who are willing to understand that many people's experience of homelessness, Jesse talked a little bit about like back fees, or, that's the challenge with enforcement. I end up with a small citation that turns into a large problem. All of that complicates a complex issue of trying to get housing for people in a highly competitive market. So not only are we trying to get the units, but we're also trying to level the playing field in a lot of ways, that we have more units available for this population as well. Because I think, Bob, you said it really well. These are just people who right now do not have a stable place to live. When they do, they're just a tenant, a neighbor, a renter, like many of the rest of us. And we need to think about it in that way.
Absolutely.
Bob, Alpha Project owns affordable housing and operates affordable housing, those units that can solve homelessness for someone who is simply poor or too poor to afford housing. What are the biggest barriers to getting more of that housing type constructed?
Well, who wants to build low-income housing in their neighborhood? Number one. Number two, we don't have workforce housing for the working folks, teachers and cops and stuff throughout the county. So low-income housing always seems to be at the the lower rung on the totem pole. And then it's cost. It's gone. When we started, I think when we built Alpha Square, we were about $250,000 per unit. I think it's over $400,000 a unit now for a 360 square foot SRO type house or unit. And it's just that the costs have gone through the roof. The only way we can do this is through tax credits, and tax credits are competitive, and throughout the state and throughout the country. And so, from my experience, we're trying to do 273 units downtown right now, and it takes 5 to 7 years, from the time you start this process to build new units. Father Joe's, just opened their place, and we all, the providers, we house 28 people in 28 days or something like that. And, we fill them up right away. But we still got, 6,000 people waiting to get into units. And so, housing first, we agree with it, we practice it, but it's just one piece of a huge puzzle. And, and we've got to address all aspects of that. We've got to, like I said, I hate to be the fly in the ointment all the time, but we're never going to build our way out of this, even under the best scenario. I think you asked Andrew if we could have all the money in the world and do it. It's a tough challenge to do, and then also having communities that believe that a low-income housing unit is not going to be a blight on the landscape, and we're not going to bring crime to the neighborhood and all the stereotypes. If you do anything, I've been burned in effigy, hundreds of times over the decades. We want to do a facility in somebody's neighborhood. We've made a commitment to every neighborhood that we're in that's going to be better off because we're there, but that's not always the case with providers. So it's really changing the stereotypes and the stigmas related to our brothers and sisters. I hate labeling people under this banner of homelessness. They're just folks, and sometimes we take the humanity out of the conversation.
I can say I've covered several meetings where there's been a proposal for affordable housing, and people get really upset about it. Maybe the building is too tall for their aesthetic taste. Maybe they worry about traffic getting worse. Maybe they're surprisingly honest and just say openly that they don't want those type of people living in their neighborhood. Jesse, I'm wondering if you've ever been to any of those meetings or participated in those conversations about where to put affordable housing, and what would you say to those people?
I have not been to those meetings per se, but through the different avenues of learning on the situation, and even in the classes I'm in now, we've already touched on homelessness. So I see it's at the forefront of a lot of conversations, and I have heard that already, not in my backyard pretty much. Even some of the churches out here they have available real estate, and some people want to use it for housing, and other people don't want the property there for all the reasons that have been mentioned here. Like Bob said, it's about the stigma and changing that. All the other parts of our society are developing and moving forward, and we need to understand that these people still need the respect. And of course, there's outliers that kind of put that stigma there. Like sometimes crime does go up, but to to overgeneralize the entire group of people trying to get back on their feet, especially after the pandemic. I don't think people are factoring that in, that people that never even thought about they could be in that situation just because of this pandemic are now in that situation. And maybe that's going to help change the stigma on it.
Lisa, you mentioned earlier the Community Action Plan on Homelessness approved by the City of San Diego in 2019. It's a 10-year plan, and it laid out a number of goals with getting more shelter beds, more permanent housing. How are we doing with staying on top of those goals? Are we anywhere close to being on track?
Well, in some areas, I think we're actually doing really well when you compare to our goals, and in some areas, we're seeing challenges. Not surprising, right? But one of the things that we're looking at right now is waiting for the 2022 point in time count data to come out. So we actually have posted on our website in our dashboards that report out on how we're doing against the goals that were identified in the Community Action Plan. One of the key components was around creating transparency and accountability, and how do you hold the leaders that are working in this space, Tamara and I being part of the implementation of this plan, as among many others at the city and the county. Really, how do you hold people accountable if you don't know what the numbers are? So I just want to share with our community that we have dashboards up on our website. Hopefully that link will pop up for you where you can look and see how we're doing against those goals. We did really well between 2019 and 2020 in decreasing unsheltered homelessness by 12%, decreasing veterans homelessness by over 40%, veterans unsheltered homelessness, and transition-aged youth unsheltered homelessness by around 30%. And not all of that was building out more beds, right? So a lot of people think, oh, you've reduced unsheltered homelessness by putting in more shelter beds. In fact, we were also creating more flow through. So we were creating flow through out of shelter and unsheltered homelessness into housing, activating our VASH vouchers more effectively, which are veterans vouchers. But we don't know that that's what 2022 is going to look like, right? We understand that we created this plan in 2019. It was adopted October 14th, 2019. In March 2020, the global pandemic hit. So we understand that the numbers might look very different as the point in time count data comes out, and we anticipate updating our dashboards after those numbers. One area that we're doing well is in the permanent supportive housing goal, which was 2,800 units in a 10-year span, with the intention of creating 60% of that 2,800 in the first 4 years. We are at about 50% of that 2,800 in a little over 2 years. So from a permanent supportive housing development perspective, we're actually doing really well. But if the need has changed, we don't want to celebrate too quickly, right? We really want to look at how the need has changed and then recalibrate those goals.
Data on homelessness is notoriously hard to uncover or figure out. The point in time count is, I think, a pretty rudimentary, assessment of how many people are living on its streets, and it, of course, only captures one day. Tamara, can you talk to us about what challenges there are with understanding just the numbers and whether or not things are getting better or worse, and any preview on the point in time count results that are we should be expecting any day now?
Well, thank you, Andrew. And the sun is setting in San Diego and coming in my window, so that actually is kind of an interesting piece. We collect data every day in our system. So I just want to point people to our website. We have a public-facing dashboard that really represents the bigger numbers, the broader numbers that we know of people experiencing homelessness. So point in time is literally this one night versus kind of the bigger data set that we saw pre-pandemic. About 31,000 individuals went through our system in a year. During the pandemic, we saw that increase to about 38,000. In 2021, we saw that decrease to about 36,000 individuals. We have a lot of people in our region experiencing homelessness, some for very short periods of time, and you can see that in the data, and some experiencing homelessness every single day of that year that we collected the data. So we have bigger data sets. I think we focus too much on that one activity, and that activity can be really impacted by a lot of things. I'm just going to give you a little bit of a teaser. It was one of the coldest nights historically the night of the point in time. And we know people, we had our inclement weather shelter beds open. We had people who will literally scrape together every single, bit of resource they had to get a hotel night on that one night because the weather was so cold. So we can't literally live on one night's count. It is always a minimum count. It's affected by different things. And I think we need to look at our bigger data sets. And we really need to wrap our heads around, 30,000 San Diegans experiencing homelessness in a year, 38,000 in a pandemic. I'll also give you another important data set that we saw through the pandemic. About half of individuals entering shelters had no income prior to the pandemic. We saw that increase to over 60%. So the work that Bob's team does, their case managers, before about half the people had something to work with, Andrew. Now more than 2/3 are really missing that income. So that creates a longer runway for us to actually get them connected to housing, back to employment, back to the other things. So not only is it the numbers every night of people experiencing homelessness, but the changes in the challenges and characteristics that people have, especially coming out of a pandemic. Not only do we have less with income, we also have a high level of anxiety. It was stressful for all of us to have sort of this unknown environment in a pandemic, and then increased housing prices. So our work has not gotten easier. The numbers have not gotten better. But I think what we are seeing is some solutions that we're really leaning into, as Lisa said, some of the housing production, some of the rapid rehousing, some of the coordinated approach that we're looking at, more roommates, more catching people in their first homeless experience. Andrew, all of that has to come together to really frame out those individuals. We also know this population is older, unfortunately, and experiencing their first time homelessness. We have a lot of frail, medically compromised people out there experiencing unsheltered homelessness. So the number is important, but the demographics, what we learn about that population, their age range, their needs, is really one of the best and important things about that data that I think sometimes we forget.
Thank you for sharing that, because I also sometimes wondered, there has to be more to the story than just this point in time count, which is typically what we hear politicians talk about most. If a point in time count shows homelessness went down by X%, it's really to be taken with a grain of salt. Bob, you recently co-authored an op-ed in Voice of San Diego that says the city needs to increase funding for service providers so that you can raise the wages of the social workers who actually do the outreach to reach out to homeless individuals. These are, of course, very difficult jobs. Of course, there's a very high rate of burnout. How much does an outreach worker typically make, and where do you feel like that, how much needs to change? Bob, you're muted. Yeah.
Yeah. Okay, here we go. Yeah, and we've never had a day off. All through the pandemic, all of our staff were there 24/7, 365, and our frontline folks, they all got sick, they all got vaccinated, but they still got sick. They took the virus home. Their families got sick. In some cases, their grandparents got sick. In some cases, they passed away. But they showed up for work every day. And I think we're going between 19 and 23 bucks an hour for our frontline staff, our case managers, our security, our outreach folks. And, that's, and unfortunately, 20 some bucks an hour, 25 bucks an hour, 30 bucks an hour isn't a living wage in San Diego anymore. And yet our folks just keep showing up. We've been very blessed on the Alpha side of the house. Certainly we saw that at the convention center. We had 700 people, residents on our side of the building. They were there every day. And I just can't say enough for our folks that could have quit. They could have stayed home and sequestered and like everybody else, but they just kept coming to work, and they deserve to be compensated for that. And, nobody complains. They just do their job day in and day out. And so the other agencies are feeling the same way. And we can't find, we have probably 20 or 30 openings at Alpha. I know other agencies are the same way. We can't feed, we try and get college kids to come down, and they come down in about 5 minutes and turn and burn. They scream like they don't want to be there, and they go out the door. I mean, it's a tough field. I mean, we're dealing with human beings and conflicted human beings and folks in need, and our staff are folks in need too. and they face the same housing challenges as everyone does. So yeah, we got together as providers to say, take into consideration what our folks deal with every day, 24/7, that they were tremendous. They saved thousands of lives through the pandemic, being there with folks who had no other choice. Our homeless folks, we were the only ones there that were for them. We're there with them, and on the front line. Now, the convention center was great because we did have the county there, we had the housing commission there, we had the cops there, we had the clinicians there, we had all the clinics set up, and it was an outstanding experience. But once again, we were there. Our folks were there on the front line, still getting sick, still doing their job, still showing up with no complaints. And so I challenged the city. I know that Lisa and the housing commission are doing they've hired somebody to do a compensation analysis based on what frontline workers get throughout the state, and look and see if it's a fair wage for these folks to put everything on the line.
I'd like to move on to some audience questions soon, but Lisa, since you mentioned that, can you tell us more about this compensation study?
Yes, we've actually been sharing with policymakers for quite some time now that we need to we can't keep funding programs at the same level they were funded at 6 years ago, 10 years ago. A lot of the funding that has come through in the past has been fixed funding. So, the needs increase and the cost of living increases, but the funding doesn't. So this is a conversation we've been having with policymakers over the past several years. Late last year into this spring, we developed a new scope of work with a consultant to work with us to really look at benchmarking compensation, but not just benchmarking ourselves against ourselves, not social service against social service sector, looking at this social service sector against other social service sectors across the country in high cost, high need areas. Also looking at emergency responders. How are emergency responders and public safety staff being compensated compared to the work that some of the shelter and outreach teams are doing every day, which are also responding to people's crisis, trying to be an intervention and a support, trying to bring compassion to the work? How are we benchmarking against those types of positions? Because that's who we're competing with. Right. So we really need to look at when frontline staff are making $20 to $22 an hour, and you can make that at Starbucks. Are we really going to get the people that we need, that are compassionate, that provide the expectations that Jesse would have of a case manager or a service provider or an outreach worker, to be present, be compassionate, not be stressed, and be something that is a help rather than another barrier that you feel like you can't connect with? We need to compensate people appropriately. So we're working through this consultant right now, having conversations. The city's very interested in this work and is very keen to look at what these needs are. And we're very supportive of these conversations.
Jesse, can you share with us some of your interactions or experiences with outreach workers or social workers? It sounds like once you got to San Diego, having one consistent person who you were able to contact and interface with was really helpful. But in your past experience, did you, was it you were always being passed from one caseworker to another? What was that like?
Actually, I would flip those. So San Francisco, I couldn't even find help out there. And out here, I haven't had one consistent person to have contact with. Even on the veterans arm, the turnover is still ridiculous. In the 4 months I've been here, there's already been 5 caseworkers for the veterans case that I had. So I still see that. And then on the topic of compensation, I'm in 3 advocacy groups run, and they drafted a bill that went all the way to the House, but there's no compensation for that. And Uplift, that's on a volunteer basis, but I'll be working with the client in the coming weeks. So I'm thankful again for lived experience advisors, because they do pay me for my time and they treat this as it's a career. It's part of the reason why I'm even able to be here today to share my experience, because of the compensation there. But it's not really as ubiquitous as you would think it would be, because these people are where the rubber meets the road. And like Bob said, it's rough out there.
And I imagine it's really important to have one person, who can actually gain someone's trust, rather than, if somebody has been burned over and over again by a social worker who just didn't come through, or maybe it wasn't their fault, but they were put on a wait list, and I can imagine, tell me if I'm right, that being able to build trust and a rapport between a service provider, outreach worker, and a person who's experiencing homelessness is really important.
Absolutely.
That's key. That's key. It's taking time with folks, and that's the beauty of our facilities, is because it takes time. People they have been burned so many times by other programs or other workers and stuff. They're just another grain of sand on the beach. And the beauty at our facilities, 90% of my folks have lived experiences. All of our 300 plus employees, 90% of those folks all have lived experiences, and so they relate to our folks. But it takes time, especially when the folks that we deal with have all of their trust has been burned on them a million times. And for them to see consistency is the key. Consistency. If you say you're going to do something, do it, and build those relationships. And that's the key to having and that's the key, with your families and in life in general. How many people can you say that you trust? And so that was why I was so proud of our folks to continue showing up, because they weren't going to leave their people there. Everybody has a team that they work with of residents, and they weren't going to leave them there by themselves. And I can't say enough about our folks.
Here's a question from Gwen McCants, who's watching on Facebook, who asks, what options do the mentally ill or those damaged from drug use have? From what I understand, without insurance, they can only obtain a 3-day hold, and then they are let out on the streets again. Bob, you want to speak to that?
All you have to do is go to Hillcrest. The emergency room has that 15% of the population or more that I talked about, who are simply homeless because they're trapped in their mental illness. Their primary care physician is the emergency room, and they go in there and get stabilized, and then they're back on the street. And it's day in and day out. Here's something that broke my heart years ago. I actually had a couple ladies tell me that they called when they all got their cell phones. They would call the paramedics, and I'd say, well, why, Lisa? Why'd you call the paramedics? Paramedics are fine. Because they acknowledge I'm a human being, and they're nice to me. And the people in the emergency room are nice to me. And, remember when we're on the streets, most of the time we're by ourselves and we're alone. That's why we had so many people turn down their housing vouchers, because they don't want to be alone again. They want fellowship. But when you see the streets, you walk the streets of Hillcrest specifically, it's tragic. We have people that are walking biohazards. We had a young man the other day come up to our office seeking some help, obviously in stress. And we gave him some water, and we wanted him to wait for our outreach team to come. And he walked down the landing to the stairs and defecated all over himself. And then he continued to walk down the sidewalk and didn't want to talk to anybody anymore. But he was like that all day. Now he didn't sign up for that. He's a human being, and yet we don't have facilities for these folks. And that's the tragedy. That's the heartbreak that we see every day. I just had a guy die yesterday on the streets out in front of Alpha Square. So this is the stuff that we see every day. This is not unique to us, but it's tragic. And somebody needs to listen to the frontline folks and say, enough already.
The Governor Newsom, I think you alluded to this earlier on this program. Governor Gavin Newsom has a proposal to create care courts, which would be set up in each county, and they would have the power to compel a person into mental health treatment, and the county government would be required to pay for that treatment. Bob, you want to share, as an advocate in this space, what your thoughts are on that proposal?
Well, my experience over there, us crazy people, we don't think we're crazy, right? I'm crazy as a loon. I'm sure you guys got that in the last 20 minutes, but it's getting folks to recognize the fact that they may have some challenges, and to have, once again, trust in somebody to get on the medications that they need and have a safe place to stay. That has wraparound services there, assisted living facilities, where not boarding cares, but assisted living facilities where we've got clinicians there that deal specifically with mental health issues. Get people trusting you enough to get on the medications that they need so they can have some peace and dignity and quality of life. They get none of that by just allowing them to die on the streets. So I'm encouraged I don't know if I'm enthusiastic because I haven't seen it yet. People say a lot of things and do very little. I hope they do this.
Here's another question from a listener. Why not convert a commercial office property into a living space? We should have plenty of empty commercial properties. Maybe Lisa, take this one on. Adaptive reuse of commercial buildings, I think, is probably easier said than done in many cases. Have you or has the Housing Commission financed any of those types of projects? And have we learned any lessons?
We haven't financed any that type of project specifically. Certainly, that's a conversation that's happening locally and nationally because of the changes in sort of remote working. There are challenges. Building infrastructures that are built for office use are not built for ongoing day-to-day use. So some of the infrastructures around plumbing, sewer, and electrical are things to consider. So that does create a challenge. Unfortunately, in our particular community, even acquisition and rehab is going upwards of $280,000 to $400,000, to $300,000 a unit. And that's
briefly. So acquisition and rehab is you buy a market rate property, you rehabilitate it or renovate it, and then you keep the rents low.
Yes, and a market rate property that is likely already in sort of a model that would fit for that, like long-term residence inns, things of that nature. Commercial properties are real change. So if you're looking for non-congregate living, SRO type, commercial could definitely be a challenge. But we have to look at everything. We have to be willing to look at every option.
Another audience question here. What are some examples of solutions for solving homelessness that are working in San Diego or in other parts of the state or in other states? Best practices, models of success. Tamara, could you take this one? And in the very few minutes that we have left.
I was going to say, that's a big question. There are a lot of things that are working, right? One of the things when I referenced our bigger numbers of individuals experiencing homelessness, you're not seeing 30,000 people on the street. So our shelters, our outreach teams, our housing programs, all are working. We just need a lot more of it. And we need communities to embrace that we're really housing individuals with complex needs. Some of them it's just financial. Some of it's, additional supports that are needed. I think the things that we know work is housing ends someone's homeless experience. And so high cost, high needs, but that's really where we lean in. And we're trying to do a better job of getting people quicker through our system to have those housing resources. And, Lisa kind of touched on it. We need a myriad of housing options that meet their needs, everything from board and care to permanent supported housing. And that's really the work that we're doing. We're putting resources into all of those areas. We can't wait, as Bob said, to bill our way out of it. So we're looking for not just property that we can do, but, small apartments, rehabbing some of those things as well. So I think it's a full court press on the funding that's available that is coming to our community to try and get as many housing units as we possibly can to house people in all the different ways that they need. Some of them need to be housed with the person that they are comfortable with. They need a roommate. They need community. They need to be embraced by us in our community as we rehouse them, and they bring so much to us. And restoring the dignity and respect of San Diegans is a worthy cause.
We're just about out of time, but I want to ask each of you the same question. I imagine a lot of people are listening and watching and are wondering what they can do to help this situation. What would you say to those folks who want to be a part of the solution to homelessness, but just don't know what to do? Bob, why don't we start with you?
Oh, yeah, stick me with that question. I say pray for us, number one, but, be more involved in any way you possibly can. I mean, volunteerism is great. We're seeing that come back to life now. We haven't been able to do that for 2 years. But, you hear stereotypes about homeless folks. Come down to our facilities and meet our folks one-on-one. Hopefully we'll be able to get back to congregate meals at some point and have folks come down and serve meals. That's therapeutic for our residents to see somebody other than me and our folks down there that see the community does care. That's been a big deal. But not having our volunteers show up and kids come down with socks and sock drives and stuff, because it's really an affirmation that, not everybody's against homeless people, that people come down here and spend their time with you and care. So hopefully here in the near future, we'll be able to re-engage with the folks in the community, come down and see what we do and be involved.
Lisa, things folks can do to help out if they don't know how?
Absolutely. Humanize homelessness. All homelessness means is you've lost housing. We need to talk about our challenges as a society. Everybody knows someone or has had someone they know and love who has either experienced homelessness or experienced drug addiction, substance use disorders, behavioral health challenges. We need to start humanizing our challenges, and we need to humanize this work. And part of humanizing it is saying, yes, in my neighborhood, right? All that means when you put affordable housing in a neighborhood is that it's housing people can afford, right? And we need a variety of housing resources. We need a variety of housing levels, whether it's middle income housing, affordable housing, permanent supportive housing, support housing in your neighborhood. Then you won't have those homelessness challenges.
Tamara?
I'm just going to say ditto to Bob and Lisa. I think, volunteer, get to know the individuals that you have a great concern about. They will humanize it. Say yes to not only housing in your community, but in all communities, right? It is important to have housing, workforce housing that someone on a fixed income. We have people with disabilities that have an income and can't afford it. So I would also say to landlords, it is actually a great option to take someone who has a housing resource with the supports that they need. I think it's yes, 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 say yes to solving homelessness by opening up employment, housing, volunteer, fund this, and be a part of the conversation. We hear a lot from the no's. Those are the loudest voices in the room. I think a lot of people are more willing and more compassionate in San Diego than show up in our community meetings. So you need to show up and voice, that you're one that cares about your neighbors and cares about others. And if we're really honest, we're talking about people in our own families, in our own circles that have these same challenges. And I think we need to just break down those barriers and acknowledge that it's tough times and everyone's struggling.
Jesse, I want to give you the last word here. What would you say to folks who want to help out but don't know how?
Of course, volunteering, definitely, but also just small acts of kindness and compassion. If you encounter somebody that's going through a traumatic time, wherever they're at, just small acts, they'll help you remember they're still human and help them remember that they still matter. It's just those little acts of kindness that make all the difference, especially in my own experience. And also in the age of the internet, you can also reach out and support bills that will help the processes. Like, for instance, what Run does. So you can even go online, reach out to the people that you vote for. That's easier now than it's ever been. So at all different levels, you can do whatever works for that individual person.
Well, we opened with this quote that homelessness is a crisis of community, not just affordable housing or addiction. And I think that means also that the community has to be the solution. So I hope everyone here learned something tonight. A huge thank you to all of our distinguished guests, Lisa Jones, Jesse Gray, Bob McElroy, and Tamara Kohler. And a thank you to our audience for joining us tonight. If you enjoyed this discussion, please stay in touch with KPBS. You can, of course, see all of our news stories at kpbs.org. You can sign up for our newsletters at kpbs.org/newsletters. I'm Andrew Bowen. My Twitter handle is @ACBowen. Thank you so much for joining us and have a great night.